So very good evening everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on informed consent. As you see that informed consent is not equal to research participant signature on the consent form. And this is the ongoing discussion of the interaction during study visits. First is recruitment process, then consent form, initial consent. In the consent form, initial consent to be given by the participant, then new risk information to be told to the participant, change in research and easy procedures, visits should be discussed with the participant, loss or gain of subject capacity to consent, then change in drug status, for example approval, withdrawn from market, then study extension, then follow-up is the lifetime for gene transfer or cancer studies. Before that is the end of the study. Then follow-up is the, for example, lifetime to gene transfer or cancer studies, and long term. So this is the ongoing discussion of the interaction during study visits. So informed consent protects the individual's autonomy. Participants there should be providing relevant information to potential participants and ensuring the information is comprehended by them and assuring the participant for the voluntariness of participation. The informed consent document ICD has two parts: patient/participant information sheet PIS and informed consent form ICF. An informed consent form must include the following: statement mentioning that it is research, purpose and methods of the research in simple language, expected duration of the participation and frequency of contact with estimated number of participants to be enrolled, types of data collection and methods, benefits to the participant, community or others that might reasonably be expected as an outcome of research, any foreseeable risks, discomfort or inconvenience to the participant resulting from participation in the study, extent to which confidentiality of records could be maintained, such as the limits to which the researcher would be able to safeguard confidentiality and the anticipated consequences of breach of confidentiality. An informed consent form must include the following: payment of reimbursement for participation and incidental expenses depending on the type of study, free treatment and compensation of participants for research related injury and harm, freedom of the individual to participate and withdraw from research at any time without penalty or loss of benefits to which the participant would otherwise be entitled, the identity of the research team and contact persons with addresses and phone numbers, for example PI/co-PI for queries related to the research, and chairperson of the member secretary or helpline for appeal against violations of ethical principles and human rights. In addition, the following elements may also be required depending on the type of study: any alternative procedures or courses of treatment that might be as advantageous to the participant as the ones to which he is going to be subjected. If there is a possibility that the research could lead to any stigmatizing condition, for example HIV, human immunodeficiency virus and genetic disorders, provision for pre-test and post-test counseling, insurance coverage if any for research related or other adverse events, foreseeable extent of information on possible current and future uses of the biological material and of the data to be generated from the research. This is a research article issued at May June 2002, published online May 1 2002, updated April 30, 2020. A health education program for elderly persons with visual impairments and perceived security in the performance of daily occupations, a randomized study. Then this is another original article published in the New England Journal of Medicine. Safety and efficacy of the BNT162b2 mRNA COVID-19 vaccine. Background is that severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 infection and the resulting coronavirus disease 2019 COVID-19 have afflicted tens of millions of people in a worldwide pandemic. Safe and effective vaccines are needed urgently. Methods. In an ongoing multinational placebo-controlled observer blinded pivotal efficacy trial, we randomly assigned persons 16 years of age or older in a 1:1 ratio to receive two doses 21 days apart of either placebo or the BNT162b2 vaccine candidate 30 microgram per dose. BNT162b2 is a lipid nanoparticle formulated nucleoside modified RNA vaccine that encodes a perfusion stabilized membrane anchored SARS-CoV-2 full length spike protein. The primary endpoints were efficacy of the vaccine against laboratory confirmed COVID-19 and safety. Then the results, a total of 43,548 participants underwent randomization, of whom 43,448 received and this is you can go through the article also in the New England Journal of Medicine to know more about this article. When a participant is willing to participate but not willing to sign or give a thumb impression, what to do? Brainstorming question. In a study, you enroll a participant who is 17 years and 11 months old. You take his sign on the assent form and also take his mother's sign on the assent form. At the time of site monitoring after 3 months, the monitor asked to see the ICD, informed consent document. You show the assent form, comment what was wrong, if anything. Consent of parent oblique LAR, legally acceptable representative. One or both parents. One parent oblique LAR, legally acceptable representative, may be considered sufficient, no more than minimal risk and obligor that offers direct benefit to the child. Consent from both parents, more than minimal risk and obligor, offers no benefit to the child. Only one parent's consent acceptable. Other parent is deceased in case where other parent is deceased, unknown, incompetent, not reasonably available. Parent oblique LAR, legally acceptable information sheet that contains information. Research on sensitive issues related to neglect and abuse of a child and the EC Ethics Committee may waive the requirement of obtaining parental oblique LAR, legally acceptable representative consent, and prescribe an appropriate mechanism to safeguard the interests of the child. Then this is a clinical trial on modafinil. Modafinil in treating children with memory and attention problems caused by cancer, treatment for a brain tumor. Then considerations for assent. No need to document assent for children below 7 years of age. For children between 7 and 12 years, verbal oblique oral assent must be obtained in the presence of the parents oblique LAR, legally acceptable representative, and should be recorded. For children between 12 and 18 years, written assent must be obtained. Assent form also has to be signed by the parents oblique legally acceptable representative. So, age appropriateness, appropriate information sheets. An example. Could bad things happen if I join this research? Some of the tests might make you uncomfortable or the questions might be hard to answer. We will try to make sure that no bad things happen. The poke to test your blood can hurt. Sometimes the needle can leave a bruise on the skin. we can put a cream on your skin before we take blood. This cream would help so it won't hurt as much. You can say no to what we ask you to do for the research at any time and we will stop. Could the research help me? This research will not help you. We do hope to learn something from this research though, and someday we hope it will help other kids who are sick like you. Guardian consent, then child assent, child's dissent respected. Then this is the consent form, print name of the participant, signature of participant, date. Date should be according to GCP, that is 08 oblique Jan, JAN oblique 2020 or 06 J, and witness, print name of the witness, signature of witness, date 06 JAN Jan 2020, or thumbprint of participant, and there should be signature of the researcher, person taking the consent, also thumb impression, and date according to GCP. So then coming to post trial access of costly drug. This is the article on a topic once weekly dulaglutide versus once daily liraglutide in metformin treated patients with type 2 diabetes, award 6, a randomized open label phase 3 non-inferiority trial. So post trial access of costly drug can be given after completion of the trial, but the sponsor and PI should give their agreement for that post trial access. Then what is reconsent? New information pertaining to the study which has implications for participant or which changes the benefit and risk ratio. Research participant who is unconscious regains consciousness or who had suffered loss of insight regains mental competence and is able to understand the implication of the research. Then reconsent can be taken. A child becomes an adult during the course of the study. Then reconsent should be taken. Research requires a long-term follow-up or requires extension. Then reconsent can be taken. There is a change in the treatment modality, procedure, site visits, data collection methods, or tenure of participation which may impact the participant's decision to continue in the research. Then reconsent can be taken. There is possibility of disclosure of identity through data presentation or photographs in an upcoming publication. Then also reconsent should be taken. The partner oblique spouse may also be required to give additional reconsent in some of the above cases. Coming to an example, a 60-year-old diabetic Mr. Shah came to the OPD accompanied by his grandson Sonu. After undergoing some tests, he was asked if he would participate in a study evaluating an anti-diabetes agent as he met the criteria for selection. He was given a Bengali ICD informed consent document, but as he had forgotten his glasses at home, he asked Sonu to read the ICD informed consent document. So comments, the grandson asked for an English ICD informed consent document as could not read Bengali. After reading the English ICD informed consent document, he asked questions about the frequency of follow-ups and compensation for visits. He was satisfied with Dr. Jaj's explanation, signed and dated the English ICD informed consent document as LAR, legal acceptable representative. Mr. Saha also signed the same ICD informed consent document in Hindi. The nurse in the OPD outpatient department signed as witness. Dr. Sen also signed the ICD informed consent document. Mr. Saha was enrolled into the study. Then coming to privacy and confidentiality. Principle of transparency and accountability ensure that photographs or other information that may reveal the individual's identity are not published, a specific consent or re-consent required for publication, safeguard the right to privacy of the participants. So, ethics committee should ensure this done. Researchers should safeguard the confidentiality of data and privacy of participants, and ethics committee should ensure this is done. Three critical essential elements: voluntarism, information disclosure, decision making capacity. So in this case, you can give your comment. In this case, the nurse in the OPD signed as witness. So it should not be, nurse cannot be a witness here. So correctly informed consent document to be signed and fill up according to GCP, good clinical practice. So that's all for today, and you can ask questions in the comment box so that I will try my best to answer the questions of yours. So you go through different articles on informed consent and also different guidelines, new drug clinical trial rules, also to know about the informed consent properly, informed consent documents, and you can learn more and more from different clinical trial books and also from guidelines, good clinical, I said GCP, good clinical practice guidelines. So thank you for watching my videos and subscribing my channel. Thank you again. Jai Jagannath.